let's talk about breastfeeding. The Women's is an accredited baby-friendly hospital and follows the World Health Organization and UNICEF 10 Steps to Successful Breastfeeding Education model. Their recommendation is to breastfeed exclusively with no other fluids or foods until around 6 months of age, and then to continue to breastfeed as part of your baby's diet until 2 years of age or beyond. Having support in labour and following active birth principles can have a positive impact on breastfeeding and milk production. We also promote and support skin-to-skin contact to enhance bonding and the breastfeeding experience. Keeping your baby in the same room as you is the safest place for your baby and helps you to recognise the signs that your baby is ready for a feed, is tired, or needs a cuddle. At the Women's, if your baby is well, it will be in the room with you all the time. Like any new relationship, it takes time to understand the behaviours and nuances of a new partner, so too with a newborn and their mother. Therefore, most women will need help and support to get it right. It doesn't always come easily, but generally, with persistence, it does get easier. Well, breast milk provides all the nutrition your baby needs for the first 6 months of life and can give your baby most of their nutrition for the first year of their life and beyond. There are many other reasons why we recommend breastfeeding for baby, mother, and the greater community. It is the perfect food for your baby's needs. It provides them with immunity. Less babies will develop allergies and diabetes, and it promotes positive mental development. Breast milk comes ready-made and changes according to your baby's needs. The first milk or colostrum acts as a food, also as a laxative, and helps with sleep. Skin-to-skin contact enhances bonding. Breastfeeding helps to reduce the risk of sudden infant death syndrome. Breastfeeding reduces the risk of breast and ovarian cancer. It assists the uterus to return to normal shape and size following birth. It also assists with weight loss after birth. It helps to decrease the risk of type 2 diabetes and heart disease. And for the mother, skin-to-skin contact enhances bonding. Breastfeeding is convenient and free. It has a lower environmental footprint and less impact on our healthcare system. Breastfeeding, according to your baby's needs, is sometimes called demand feeding and is recommended. This means offering a feed whenever your baby shows signs of wanting to feed, called feeding cues. In the first few months, babies require a minimum of 7 to 8 feeds every 24 hours and often more. It is common for babies to feed 10 to 12 times every 24 hours, including overnight, especially in the first 6 months.
Breast milk, the perfect food for your baby. There is nothing else like it. Breastfeeding helps you and your baby feel close. It is your baby's first immunisation. It helps prevent serious infections and many illnesses. Breastfeeding also helps protect your baby from SIDS. Breastfeeding is really important for mum's health too, protecting you from breast and ovarian cancer and helping you to lose your pregnancy weight. What's more, breastfeeding is much easier, especially when you're out and about. You're never going to forget the milk. From the moment they are born, babies let us know when they are ready for a feed. They will bring their hands up to their face and mouth. Turn their head looking for your breast. Poke their tongue out. Open their mouths wide. This is a great time to feed your baby. No matter how or where they breastfeed, mums find holding their baby close and supporting them behind their shoulders allows their baby to feel comfortable and secure. Mum now relaxes into the feed. When breastfeeding, touch your nipple near to baby's nose. This helps baby open their mouth widely and get a big mouthful of breast as they latch on. Mum's nipple is now pointed upwards to the right spot at the roof of baby's mouth. When your baby is attached well, your baby's chin will gently massage your breast, helping your milk to flow well. You'll see baby regularly sucking and swallowing. Here, baby is only attached to the tip of mum's nipple. Mum wants to try and get a deeper latch, so she takes baby off the breast by placing her finger in the corner of baby's mouth to break the suction. So mum and baby can try again. Whoops! You may notice your baby does this too. Don't worry, it's normal to spit up a little bit of milk after a feed. He is not upset at all, just full. Having a baby means you are going to see a lot of nappies. This is a typical breastfed baby's nappy, a nice watery yellow poo. Your baby's poo will also have some lumps that look like seedy mustard. This is all normal and a great sign of a well-fed baby. You may want to express some breast milk. This may be useful if your breasts feel a little too full in the first few days after your milk comes in. You may want to give your baby a little extra milk, or if you need to be away from your baby. This mum is expressing milk by hand. Her fingers are placed on the edge of her areola, and we can see her gently pressing the breast tissue to help the milk begin to flow. Usually, when babies have finished a breastfeed, they are relaxed. This is a lovely time for you and your baby to enjoy gazing and talking together.
Breast milk changes from birth onwards, starting with a few drops of colostrum and then changing and increasing in amount to mature milk around 2 weeks of age. Making breast milk is directly affected by the frequency and effectiveness of breastfeeding, together with a well-balanced diet and rest for mum. The baby's stomach is only the size of a large marble at birth, requiring relatively small amounts. Over the next week it will double in size, and by 2 to 3 weeks it's about the size of a small egg. Their stomach will remain this size for approximately 3 months. Therefore, a baby will require frequent feeding day and night. This is normal. Some of the problems lactating mothers experience in their early breastfeeding days are from babies finding it difficult to attach to the breast. After a few weeks, women often say they feel more confident with breastfeeding. So be patient and get support, especially in the early days. Seek support from your midwife while in hospital care. One of the keys to successful breastfeeding is good positioning and attachment. Your midwife will certainly assist you with this, but here are some points to keep in mind. Get comfortable. Relax your shoulders and arms and take some deep breaths. Good positioning can avoid muscle strain. Hold the baby nice and close to your body, turn towards you and support it around their neck and shoulders. As you prepare to feed, your baby's nose will be near the nipple, with your baby looking up at the breast and their head tilted backwards. The breast can be held or shaped or left to hang naturally. If shaping the breast, keep in mind you want your fingers as far back from the areola as possible, particularly on the lower side to allow the baby's chin to go right into the breast. Once your baby is positioned well, your baby can either self-latch using baby-led attachment, or the mother can assist the baby to latch to the breast when the baby opens its mouth widely. If allowing baby to self-latch, position your baby near the breast and allow your baby to find the areola and nipple and attach by themselves, offering physical support as needed. If using mother-led attachment, consider the following. When your baby opens their mouth widely, this is a good time to attach them to the breast and assist them to get a deep attachment rather than a shallow one with only the nipple in their mouth. Remember, babies breastfeed, they don't nipple feed. Your baby's head will be tilted backwards so their chin will be into the breast, their nose will be free and their cheeks touching. When your baby is well attached, it should feel comfortable. If you find it is hurting, put a finger in the side of baby's mouth and break the seal. You may need to attach the baby more deeply. There should be minimal breast discomfort when the baby is attached. The baby shows that they want to feed. Their suck-swallow rhythm changes from short sucks to long, deep sucks with pauses. Baby often finishes a feed by falling asleep or coming off the breast looking satisfied. In the first few days, baby's urine and bowel output changes and increases every day. From around day 5 to around week 6, baby will have approximately 5 to 6 really wet and 1 to 2 dirty nappies every 24 hours. Their poo will generally be a yellow colour and sometimes it can be quite loose. The baby will gain weight accordingly. If you are expressing milk by hand or with a pump, go to our website for detailed information on expressing, storage and the use of breast milk. Teats and dummies and offering fluids other than breast milk may confuse your baby's sucking pattern and make breastfeeding difficult. It will possibly decrease your milk production and supply because baby may be spending less time at the breast. Therefore, we do not recommend using them, especially in the first 6 weeks when milk supply is developing and you are learning about your baby and breastfeeding. Remember, if you have difficulty breastfeeding, there are many support services available, including the breastfeeding service at the Women's. Once established, breastfeeding can become one of the most enjoyable times for you and your baby. Parenting is one of the most amazing journeys you will have, but it is also one of the most challenging. We wish you all the very best for a healthy family life together.